Hi there, you're welcome to Dami RX Cure channel where we talk about medications and how to use them properly. So you're welcome to our channel. If this is your first time on our channel, make sure you check out our other videos. And also while you're here, make sure you like and subscribe just so you can get more alerts whenever we post other videos. All right, so today's medication that we'll be talking about is actually an over-the-counter medication, and it's called Abreva. So Abreva, the generic name is called Docosanol, and this medication is used for fever blisters. So this medication is used for like a cold sore, which usually appear around the lips for patients, maybe after their body is in like a stress mode. It can also happen when a patient is exposed to maybe a viral infection. This is kind of like a first sign of how, you can kind of guess that, there's something coming up. All right, so first, let's talk about how the cold sore happens. So usually this is a cold sore that happened as a result of herpes, which is known as HSV-1. It's very common among young adults and elderly patients as well. This is why they will usually recommend that patients who are older, if you don't, you really don't want somebody that is not your family member or somebody that you're kind of aware that they're cautious to be kissing your young baby or infant. So this is a medication that's usually transmitted like earlier on, and that's why they usually don't test for it more commonly among adults, because at some point, you've probably been exposed from kissing, and other things. So this medication is used when that cold sore is triggered because our body, like I said, has something coming, or maybe we've like stressed our body so much that, the cold sore, it kind of triggers the cold sore to appear on our face. So this medication is only used around the lip, or if you get like the cold sore around your face. It's quite expensive. It's a really small tube, and it's about $20 at your local pharmacy store. Okay, so the direction you want to follow while applying this medication is you want to apply it for like 5 times a day. Usually the cold sore lesions, they're kind of very itchy, which makes you tend to want to apply it very often. So usually the limit is 5 times a day. So you apply like a thin film around the cold sore to kind of help until the lesions have healed completely. So you want to make sure you completely cover the affected area. And this is a medication that should only be used in patients who are 12 years and above. Unless you're advised by your healthcare professional that this is the only option for you, then you can go ahead and go for it if you're lower than that age. But usually we want this in patients who are 12 years and above. Okay. All right, so what are some common side effects of this medication? So a common side effect of the medication is application site reaction. So you might get some burning, redness, or itchiness or stinging when you apply the cream to it. This is very common, as most people already the lesions are usually open from itching the lesions. So make sure you're aware of that. It doesn't mean that the medication is irritating. It's probably irritating because the lesions are open, but it doesn't mean that the medication is not going to work. It's just the way the lesions are, it can cause those kind of side effects where it kind of burns or sting when you apply it. Okay, so another common side effect is headache. This is most likely due to the cold sore already. Usually patients will have a headache due to, along with that cold sore even before applying that medication. So this might not be directly due to the cream, but it's just something that usually they found out that patient have complained of while they're applying this cream. So in order for this medication to work very effectively, you want to make sure that you apply it as soon as you feel the cold sore. So as soon as, you find out it's a cold sore, make sure you apply it. Also, like I said, this is only for your face or around your lip. You don't want to apply in your genital area if you have a cold sore down there. There are other medications in the pharmacy that can be used in order to help the fever, blisters, or cold sore heal as well. You can try that. If you just call your primary care practitioner and just make an appointment, they'll be able to assign you a prescription in order to get something in the pharmacy for that cold sore if it's in the genital region. But you do not want to apply the cream down in your genitals. Okay, make sure that you wash your hands with soap and water after you're done applying it in order to have stop any reinfection around that area. So apply the cream on your hand. In order to stop that from touching another area, you want to make sure that you wash your hands very well in order for it to not be placed in another part of your body. As well as make sure that you apply a thin layer and make sure you're rubbing it gently. That way you're not scrubbing the lesions and reaffecting another part of your face or your lip area. You do not want to share this medicine with somebody else. So make sure that you're the only one using the cream, as well as make sure that you're storing it at room temperature and away from children. That way they're not able to tamper with it. All right, so I hope this video was able to help you regarding how to use the Abreva medication. Make sure you hit your like and subscribe button. That way you're able to get alerts whenever we post other videos, and we look forward to seeing more of you. All right, thank you and have a blessed day.